further ado, let me have Vicki Mandel-King come up and introduce our speaker.
Good morning. Thank you all for coming. It's my pleasure to introduce Mark Babcock to you. Mark has his master's in sociology, and he currently counsels people who are caregivers, people who suffer from chronic disorders such as pain, depression, anxiety. He also counsels those who suffer from cancer and other medical disorders. He's coming today to talk with us about the stress and what happens to caregivers. And too often, I think, we forget about that. It's kind of a different species of stress because there's someone else who's suffering and we don't think we get to acknowledge our own. I know that just from helping my mother-in-law. And I was thinking about what analogy I could use before Mark came up here to share his experience and his knowledge. And I'm just going to go ahead and do this and kind of lighten it up this morning. I have the feeling, judging by our ages here for the most part, that most of you remember a defunct airline, Pan American. Remember that? Before I became a lawyer and before I was a federal defender, I flew with Pan Am for 2 years to see the world. And I have the feeling that Mark's talk is really about what we cabin attendants used to tell everyone about the oxygen mask. You gotta put it on your faces first before you try to save anybody else. So Mark, welcome and thank you so much for coming.
Thank you. I was talking with Ray and Sam a little bit before this. There's all these cords back here behind the podium. So I have two goals. One is to give you useful information, and the second is not to trip and fall before the talk is over. It's a pleasure to be here today. I think so much important work occurs with this organization, and it's an honor to be asked to come and speak before it. And I wanted to especially thank Vicki, who's been wonderful in answering emails and phone calls and helping me get organized for this and giving me ideas on what kind of information I can come and convey to you guys. So as she was saying, some of the work I do is at the hospital. I work in the rehabilitation unit, helping people adjust to neurological difficulties, cancer sometimes, over at the Tebow Center. So I do a lot of medical social work through the hospital, and then I have a private practice in town as well, where I think with people about these kind of things. And caregivers are some of my toughest folks to work with because they are so committed to doing what they're doing. They tend to put their needs secondary, and so it's really hard to be in this spot where you're trying to help them take care of themselves. Like Vicki said, the talk that the cabin attendants gave was directed towards us, right? The people who aren't caregivers, they know to put the mask over their face first. We need to be reminded of that. Before I get into the crux of my remarks, I wanted to find out how long people have been in this role. People who've been doing caregiving for 3 months or less, could you raise your hand? 6 months or less?
Mark, you mean right now doing it or have done it?
Right now, actively.
You might want to ask how many are caregivers right now.
Okay.
Not everybody is here because...
How many are caregivers right now? Okay. Very good. And how many have been doing it for 9 months or more? Wow, okay. And a year or more? Wow, okay, excellent. So you brought up an important distinction. Many people here are caregivers. Who are you other people and why are you here? in.
You want to get as much as you can.
Right. So what I'll discuss today is some important tools to help you put in your toolbox to use to take good care of yourself. Some are known, some are going to be repeats of things that you already are aware of, others are going to be perhaps new and even weird. But before we get to those, I wanted to explain a little bit about compassion fatigue or burnout. I'll start my remarks in that manner, how it occurs, the warning signs, what not to do, what to do, and then I'll go into a couple of energy psychology techniques if you want. So the handout is prepared in the format of a PowerPoint presentation, so if you just follow along, I think you'll be able to keep up with the remarks really well. So the first question is, what is compassion fatigue? And that's when we focus on the needs of others in an imbalanced way where we're not tending to our own. And this happens to everyone. It's not something that happens to people who are weaker than others, who fail in some way. Anybody who's in that dynamic for a long enough period of time will eventually experience compassion fatigue. Of course, it's on a continuum, and there's milder cases and more severe cases, and in some instances, I've seen people I work with at the hospital who just burn out after years and years of taking care of people and go on disability for 6 months or more because their adrenal glands and their energy system is so exhausted. And that's not an indictment of them by any means. It's just part of the territory when you enter into a profession of caretaking. So one term that we often hear is burnout. What is burnout? So if there's compassion satisfaction, because obviously taking care of others can lead and result in a lot of satisfaction. That's the good stuff. Burnout would be the bad stuff. So that can happen gradually over many years generally. In terms of what do we mean by it, according to the research, it can mean a sense of hopelessness. So in severe cases, burnout can result in a sense of learned helplessness, hopelessness. So if you have compassion fatigue on one branch, you have burnout. More contemporarily, we've decided to reframe it or relabel it, call it secondary trauma. And this usually happens as a result of experiencing it in a secondhand way. So hearing stories. So a clinician in a mental health clinic who hears stories of people's difficulties for a long period of time can experience secondary trauma. And that onset too is gradual. Now this is contrasted to traumatic stress, where it's primary. You're exposed to it, and it can happen immediately or relatively quick onset. When I was talking to Vicki before the talk, she was talking about, well, some of the people in our organization acquire it because they have to take care of others who have open wounds and so forth. So they have to go get some trauma work, like some eye movement desensitization and reprocessing, or EMDR, to help them to release the trauma that they've acquired from a more direct or primary role of caretaking. There's a nice definition by Carl Leroux of compassion fatigue, and he frames it as more of an energetic experience. So it's the result of unconsciously absorbing and internalizing the energy and motion of others. Simply, it can lead to sensitivity overload. So energetically, think of it in terms of it being held by the body. So there's many different memory systems in the body. One is explicit, and that's factual memory, so knowing your date of birth, your address, your phone number, your social security number. And then there's implicit memory, which is more muscle memory. So that's how to ride a bike, how to play tennis, how to run, how to walk. Those things, once you learn them, your muscles keep that information. And you can not ride a bike for years and then get on a bike and pick it right up and you'll do fine. Over time, when you're in a caretaking dynamic, you can unconsciously, without even being aware of it, pick up just a lot of energy that's putting layers on your nervous system. The research shows us that this energy is held in the brain, in nonverbal areas. In the more reptilian parts of the brain, what they call the limbic system, this is where it's stored. And it's usually housed in terms of smells, sounds. Sometimes we'll get a whiff of something that'll take us, to a real vehement memory about something. We might not even be able to associate ourselves with what that's about, but it's there. It's a way of our body reminding us of something important to pay attention to. How do we reach compassion fatigue? For most of us, it's been something that we've been doing throughout our life. A lot of us live our lives in a form of service to others. Others come into this role, because someone has acquired a major medical illness or terminal illness, and now they're in a primary position of taking care of them. In those types of situations, it can be complicated. So if you enter into the relationship of taking care of somebody else, your system can already be exhausted from years and years of taking care of other people. That's another example of how it gradually can occur over time. And you might not even be aware of it because we have a way of just pushing it into the background and going forward. What are some things that can complicate compassion fatigue? Concurrently, if we're going through other major life stressors, such as a divorce, if we're having money problems, if we're having our own health problems. Some of us, when we're taking care of others, are having to work, so we're doing that in addition to the stress that we have with working or the stress that we have with taking care of a person. Other important factors are there alcohol issues involved? Whose turf are we on? Are we going to a family member's home to take care of this? Are we having to come from out of the area to take care of it? Are we having to go across country to a different time zone? Do we have support in that area? Recently I had to go back to Virginia. My dad was going through some major medical problems, and so I was not on my turf. And I was going into a situation, kind of stepping in at the 11th hour. There were a lot of dynamics that were already going on. My dad had been living with my brother for about 6 weeks, and so he and his wife had a certain picture of what was going on, and it was really helpful to me to do a lot of calling to my sister-in-law to check out what I was experiencing, to see if that fit with her experience, and then we were texting. So that was sort of my lifeline. And they live in an area of Virginia near Virginia Beach, so you have cell phone service, all the modern amenities. It's real nice. My dad, on the other hand, lives 2 hours away in North Carolina, which is in this part of North Carolina, which is in the middle of nowhere. There's no cell phone service. So there was this one period when we were coming back from Duke Medical Center, and we stopped off on the way back to my brother's at my dad's house so he could visit with some people and get some things. And I was feeling particularly stressed, but I couldn't download because I had no cell phone service, so I couldn't call and talk to my sister-in-law. I couldn't call and talk to my brother. I couldn't text them to check out different perceptions I was having. So that was a really stressful day for me. So I offer that in terms of not all caregiving situations are the same. You know, some of them are in this category of moderate to severe stress because so many other things are going on, where the person is isolated in ways that they're not in their community. You know, they might have to travel to a different place to take care of the person with the terminal illness. So all that can ratchet up the stress that the person's under, you know, a notch or 3. And then another important question, I think, is are all the caregivers on the same page? Or are all the kids on the same page? Or are all the siblings on the same page? If not, then that makes it much more complicated, much more stressful. And that was the situation when I went back east, is that my brother and I were on one page and my sister was in another book. So, from your reaction, it sounds like some of you have had the same experience. We can talk more about that later. So we'll go on to the next slide, which talks a little bit about removing the stigma. So I touched on this a little bit in the beginning, and that's that if you enter, or when you enter into the position as a caregiver, you're already in play. Your energy system is already being drained. So don't think you're immune from this, or your vulnerability goes up even more, because then you're not really facing reality, I guess is one way to put it. You know, you're thinking, well, it never happens to me, or I take really good care of myself, so I'll be okay. And no matter how good care you take of yourself, my experience has been it has to go up even more. Think of your energy system as a bank account, like a checking account. So you're caregiving and you're just writing checks all day long. And if you're not putting some deposits in, you're going to get overdrawn, and then you're going to get the nasty overdraft charges. And that can be some symptoms that we talk about, or some behaviors that we talk about in a little bit. So the first step in managing it, in healing it, is realizing that it's real and that it's there. And again, it's something that all of us none of us are immune to. All of us are subject to acquiring. I just can't make that point hard enough and long enough, I think, because so many of us, you know, have just done such a great job of compartmentalizing our needs and putting them in the background. We just think we can forge through anything. And sometimes we can, and then it hits afterwards. So sometimes after the person dies, you know, it can happen up to 6 months later. We think, okay, well, we've got through it. I'm still okay, I'm still healthy. And then it can sometimes be 6 weeks after the person dies. All of a sudden, we're having panic attacks, or all of a sudden, we're not sleeping, or all of a sudden, we're not very effective at work, or all of a sudden, people are asking us why we're so damn cranky. And we don't always associate it because the event is so much after the passing of the person. And it can be 6 months later. So it's not always immediate. There's not always this clear, direct correlation. So again, most of us who talk about compassion fatigue believe it's not a matter of if, but when. So, and even if you don't hit the severe stages of compassion fatigue, where you're experiencing some of the things that I talked about, it's still important to fill your energy system back up long after you think you've already completed it.
Mark, could you just repeat what the symptoms are for all of us who think, well, it's not going to happen to me, and I won't have it, because how do we realize it?
Good question. So that's a few slides ahead, but I'll jump ahead to that in the spirit of answering your question. So if you go, I'm not sure what page is on, but the heading is Warning Signs of Compassion Fatigue.
Yeah.
2, page 2. So that's we've arrived in the overload department. None of us set out to get there, but and we were unaware we were even heading there. And then before we know it, we find out that that's where we are. How do we find out that we're there? We really don't seem to have a sense of humor. We don't laugh as much. We don't make clever remarks as much. Nothing really seems to help us to chuckle. Sometimes people will say stuff to me like, I can't remember the last time I laughed, or I can't remember the last time I found a joke funny. So that resiliency is kind of gone. Your system no longer has the ability to react in that manner. So that's one example of the checking account being low or into overdraft area. Another more frequent one is irritability. We're just really, really cranky, and we're just really, really short. And a lot of times that can happen because we're not sleeping. So one of the first places that I start with people if they come in for counseling is to ask them how they're sleeping. Are you having trouble falling asleep? Are you able to stay asleep? How long does it take you to go back to sleep when you wake up at 2 o'clock? Are you having nightmares? How long has that been going on? And in a lot of cases, like I saw someone a couple weeks ago, and his energy system was so tapped out that we couldn't really start with behavioral techniques for insomnia. I pretty much found myself saying to him, you need to leave here, call your primary care physician, talk to him about getting on some sleep medication, and start taking them like yesterday. Because your system is so bankrupt, and you're experiencing moderate to severe depression, you're breaking down during the day, you're crying, we don't really have time to mess around. And that can be a tough sell, honestly, in Boulder, because nobody likes to go on medication. Nobody likes to take sleep medication. So I don't say that in a cavalier manner. I know that when I say that I'm breaking some local taboo, but sometimes you really have to shake a person and say to them, in a nice way, you're a lot worse than you think you are. Because it does really no good to give them false hope and say, oh, this is just going to get better, and if you go for a walk 1 time a day for 5 to 10 minutes, do some mindfulness techniques, drink plenty of water, you should do okay. So sometimes you've really got to get their attention right away, because they're heading over the cliff, and they might not know it. They know it's bad, but we all have this wonderful capacity to minimize things. So a lot of times if I ask them about their sleep and find out about their sleep, that tells me a lot about how they're doing. And if we can work to get their sleep better, then everything else gets better. So their thinking will get better, right? If they're trying to work simultaneously, their productivity at work will go up, their ability to tolerate stress will go up, their immunity system will go up. We're just going to get ahead on every count. So that's where I start. If a person's talking about uncharacteristic feelings of depression, we might also start with sleep. Like with this fellow that I was telling you about, I said to him, some people might have you talk to your physician about an antidepressant medication because of what you're talking about. But I think if we start with sleep, that'll help your mood and then help you in other arenas as well. And he was of like mind, so that wasn't a tough sell at all. In terms of the tension we're under, a lot of people will report headaches, GI problems. And no matter how much sleep they get, they never feel rested. You know, they're not getting restorative sleep. They're chronically late. You know, they're never on time for anything. And these might be people who are on time. I mean, that was one of their sources of pride in their life, is they were always a little early, they were always on time. So they're just not keeping up, and then these can develop into feelings of inadequacy. I'm not meeting my own expectations. And that's a place where I try and do a lot of work with people, is just getting them to reprioritize or recalibrate their expectations. For some people, well, let me back up. If we have to cut back in certain areas, you know, what are some ways that we can cut back in order for you to have the energy you need to meet the demands of being in this caregiving, this really stressful situation? So you might have to let your house go a little bit. You might not be able to keep it as clean as you want it to. You might have to let your yard go a little bit. You might have to let your flowers go a little bit. You might not be able to plant as many flowers as you wanted to this year. I mean, areas that can sound silly to some of us are really important to other areas. Like, I was working with a fellow who always had the nicest yard in the neighborhood, and that was a real source of pride for him. And in the spirit of trying to help him think about where he was going to withdraw some of his energy from in order to have it available to rest more, he decided to cut back and mow his yard less and water it less. And it doesn't sound like a big thing, but if you find one of those, another situation here, another area there, it can really help to conserve energy. So in short, what we're talking about is setting limits, or setting boundaries, or saying no. So it can be situations like, I usually stopped at the store on the way home from work and picked up a few things, but now I'm having someone else do that, and instead I'm leaving work, going for a walk for a half hour, 3 days a week before I go into the caregiving situation. So I can do some self-pacing and kind of reset my energy from the day, get some downtime before I go into this demanding situation. So you have to ask for help, which is one of the hardest things for caregivers to do, or people who are kind of born in to be of service to others to do, because we're just supposed to be able to do everything. And we'll just sleep less, or exercise less, or do all those self-care things less. Well, one area that I've had virtually no clinical success in is convincing caregivers that they need to take a respite. I don't think I've ever had one person in the 25 years I've been doing this follow my advice, but I keep giving it anyway. But I'll say, like, have you thought about having someone else take care of them so you can go away for a long weekend? Well, yeah, we've thought about it, and then they'll list 15 reasons why it's impossible. And a lot of it comes down to guilt. They just feel guilty if they're not there, or they're the ones who know how to take care of them the best, or they're the only ones who really get how to disseminate the medications, and so on and so forth. So, I say that tongue-in-cheek, but I think that's an example of how committed and how dedicated, we feel when we get into this dynamic, when we get into this situation. Let me back up a little bit. I know we had talked about, and I forgot to mention this in the beginning, about holding questions to the end, but I can see at this point if anybody has any questions so far. Okay, so I'll just keep going. So one of the biggest things that stress us out is the sense of time. We don't have enough time, to do what we need to do. We're just feeling so pressured. And I think one thing that's helpful is for us to try to determine if it's external pressure. So for instance, are we having to meet a demand, like be it a doctor's appointment at a certain time, or is it internal pressure where, you know, I only have a half hour to give them a bath, or I only have a half hour to shower them. And then what would happen if you went longer than a half hour? I mean, sometimes it's a big deal. Other times it's just, I don't know, that's just where I slaughtered it. That's just what I thought. So if it, you know, rolls over and goes to 40 minutes, is it really that big of a deal? You know, do you have the room to flex with that? So my point is, a lot of this is self-imposed. A lot of this is internally generated. So those are the ones that should be easier to fix, huh? Because we're the ones then who can recalibrate. Easier said than done, I get it. Sometimes I'll start off with the person and we'll kind of go down that list and like what things could you change? What things could you do different? What expectations could you rearrange? And their general response is absolutely none. You know, everything is life or death. So then we talk about it a little bit more to really explore that, to see, you know, who would perish or who wouldn't be around if they cut back a little bit in this area, or cut back a little bit in that area. So sometimes you have to really paint things in a very distinct way to help people flex in their thinking, because most of us get into the spot where, you know, this is how it has to occur, this is how it has to happen. So if we go to the slide after warning signs of compassion fatigue to what not to do. So what not to do, you know, those are pretty straightforward. Those are pretty known to us all. You know, make major life decisions that can or can't be possible. Sometimes at work, when people are really stressed, you know, we'll just stand around and complain a little bit too much, and that's not really helpful to anybody. It just is kind of exacerbating what is already a very stressful situation. So you have to modulate, I guess, how much you do talk about this situation. And sometimes if, you know, if you're in a situation where, pardon me, that's all you do seem to be talking about, or it's out of balance, it's not necessarily helpful to just keep ruminating and just keep complaining about it after a certain point. Obviously, what not to do, self-medicate. So we all are susceptible to numb ourselves when we're going through really stressful times. So be aware of any behaviors you're doing in that area. So there's the obvious ones like too much alcohol, you know, too many drugs, too much TV, too much reading. So food, that's a great one. Too much sugar. So overeating. You know, I've heard people say stuff like, since I've started this, I've gained 10 pounds, or I've gained 15 pounds. Very common. So we're just tending to do behaviors that are kind of keeping us out of our body, keeping us out of our pain or our stress, and trying to soothe ourselves. So in a few minutes I want to go into some different ways that we can soothe ourselves. So what to do? Different ways we can reconnect and rebuild. So the first one obviously is to accept that this is normal. This happens to everybody. 100% of the people that are in this position experience this. So again, it's not a sign of not being tough enough. Get your sleep in a way that it's restorative, whatever it has to be. Some people can benefit from getting a CD that helps them relax. They'll put that in before they go to sleep, and then they go to sleep quicker. If they wake up during the night, they'll put the CD in, or I guess now on their iPod, they'll call up an app on their iPod. or iPhone, and I'm a low-tech guy in a high-tech world. I don't even have a smartphone yet, so you can see how far behind I am. But they can get by with that. In other words, they don't have to go the medication route. Starting with that tool can help them get the sleep that they need. Others, you beef up the exercise and they'll start sleeping better. Others will need sleep medication. They might not need it every night, maybe every other night. A little bit of Ambien can help them get the restorative sleep that they need to meet the demands. Because when somebody comes into my office, the things that I'm looking at to see how much help they need is, what is their tolerance of stress like now? What was it like 3 months ago? What was it like 6 months ago? What's it been generally like in their lives? And what's their resiliency like? How much more volume do they have left to absorb the stressors that are going to be coming down the pike? So some people have a lot left in the tank, some minimal amount, and some they're on fumes. So ideally, do something daily to replenish yourself. That can take the form of exercise, having a meaningful conversation with somebody. So obviously one of the recommendations are when you eat, try to have at least one meal with someone else and try to have a conversation. Remember what we used to do 15, 20 years ago? We'd all sit down at the table for supper and nobody was texting and nobody was looking at the Hulu and all that stuff on their phones. So try to stay connected to others. That is really, really important. Whether it is in any form, but the more isolated you become, then that's another vulnerability factor that ratchets up on the scale for you to acquire the compassion fatigue more quickly. Breathing. Keep breathing, I tell my folks. This one, of course, I don't mean to be flippant about it, but be aware of your breathing. Is it shallow and rapid, which most of us do when we're stressed? Are we doing diaphragmatic breathing? Nice deep throughout the day. Again, if you go to the top of the other column, it talks about setting limits. So trying to delegate. I remember last year about this time I was going through a bad bout of compassion fatigue, and I had to start using some of my own advice, right? And one of the hardest things was for me to ask other people for help, because I was always supposed to do it all. And so people would say, well, do you want me to do such and such? And my almost knee-jerk reaction was, no, I got that. And then I would say, well, wait a minute, it actually would be very helpful if you could do such and such and so. So there are all these people that were wanting to help me, and that was a really uncomfortable position for me to be in. But I really had to use it as an opportunity to enact and employ some of these techniques that I knew about, but was having a hard time using. And people, we all like to help other people when they need it, right? So it was a gift to them in a lot of ways to be able to be of service to me. So again, taking time off, taking respites, even if you leave work an hour early, or even if you're some of us are, we're working, have a hard time taking a lunch, where we'll actually leave the office and go somewhere different to eat, to get a change of scenery. That can be really important. So the one thing that I would encourage you to think about is maybe changing the scenery when you have lunch. If you go outside, or if you go, you don't have to get in your car and go across town and make it a big deal, but just try to do something different to change the scenery, change the energy, change your flow. And then it's going to be a lot easier to check into your breathing, when you change venues. So a lot of this is staying in touch with your body, checking in, seeing physiologically what's going on. There's some other ideas as well. positive reframing or looking at situations as the glass being half full. Journaling, that can be real helpful, so we can look back and see where we were a week ago, see where we were a month ago, so we can compare and contrast at that point. Because it tends to, at least for me sometimes, it tends to blur together, and I think, oh, well, that wasn't so bad, and then I'll look back at some text messages I've saved or some journaling I've done and thought, oh, that was a lot. This has been going on a lot longer than I thought. I thought it was only going on 72 hours, but it's been going on for a week. So I've really got to go for a longer bike ride today, or whatever, to work on my energy. So now, go into the meat of the presentation, thinking a little bit about how to create a self-care plan. So think about using some of those tools that I just talked about. And then in terms of some of the other ones I've given you on the handout, there are grounding techniques. There is a whole page for that. And one grounding technique that didn't get on the page, but should have, was to go outside. You know, or if you're outside, go inside. But change the temperature, change the lighting, change what you're being aware of. A lot of those are not novel. They're known to all of us. It's just about remembering them and using them. In really strenuous cases, people will use some of the more radical ones. Like there was a person I was working with, and she was having a really difficult time staying in her body because she was under so much stress. So what she found to be helpful was to stick her hand in a bucket of ice. That would help her feel her hand, or in a way that, because she couldn't feel it before. I mean, she could have cut it and she would have never known. So that's how stress, that's an example of how stress can push us outside of our body. For some people, swimming is a nice way, not to not only get exercise, but to ground themselves. Sam will probably not be happy if I do this, because I'm going to go away from the camera, but when you're sitting, make sure that you have your feet flat on the floor. I was working with someone earlier in the week, and she came into the office and she had her feet, you know, like this, and it was just yet another sign that she wasn't grounded. So I just, you know, in our work, encourage her to put her feet flat on the floor, and then we start there and kind of add more and more layers to help her feel more grounded. Another technique that can help us feel grounded is called Cook's Hookup. We can all practice that. Sam, I might need your help to figure out how to do this and not trip over the wiring and stay on camera and so forth. Some of you are probably familiar with Cook's Hookup. You haven't heard of it? Okay.
I know this.
Okay. So, is it okay if I push this over? So again, if we're thinking about compassion fatigue as an energy disorder, a nice way to help us rebalance our energy is to do Cook's Hookup. And it takes approximately 2 minutes, which is another reason I like it, because if I've found over time, if I give people techniques that take 15 or 20 minutes, they don't use them because they want more rapid relief. So how this one works, we can all practice it. You're welcome to join in if you want. Is you start by putting one ankle on top of the other. And this is written in your handout, so you don't have to write it down.
Does it matter which ankle goes over?
No, ultimately not. It doesn't matter what ankle you start with.
Oh, okay.
And then you put your arms in front of you, and you put the opposite wrist on top. So if you have your left ankle on top, you now put your right wrist on top. And then you bring your palms together like this, and bring those into your chest. So far, so good. Put your palms like this. Bring them into your chest, and then you just sit there for a minute. As you breathe in through your nose, you can put your tongue behind your top teeth. As you exhale, you can put your tongue behind your bottom teeth. Take about a minute doing this on this side, and then we'll change position of our limbs. Okay, now just put your legs out in front of you, put the opposite ankle on top, and then put your opposite wrist on top. Bring your hands in. Just do it again for another minute. So this is called an energy correction. So whenever we're out of sorts, clumsy, dropping things, this is a good thing to do to bring your system back into balance. It's a nice self-soothing technique for many of us. So during the day at the hospital, I'll sometimes do that in between clients to recover from one person before I meet another person's energy. You can do it while you're reading, watching TV, reviewing a person's chart. You don't have to just be doing that alone.
So the only thing that's moving is the tongue going from the top to the bottom, and you're breathing in through the nose or through the mouth.
So the only thing that's moving is the tongue, other than the chest and the breathing. But as you inhale through your nose, tongue behind the top teeth, and then as you exhale through your mouth, tongue behind your bottom teeth. And there's something about crossing the midline. There's something about how that helps bring the body back into balance, back into concert. Sometimes I'll have folks do that at the beginning of our session just to help their body to be at a more centered place, so when we begin our work, it can receive whatever we're doing in a more efficient way. Another idea is to use EFT, emotional freedom technique. Some of you I know are familiar with it. You were familiar with it. Vicki uses it. Vicki says, I like it because it helps take the edge off, and then I can go do something else, and that's more effective after I've done the EFT. So that's a great way of thinking about it. Think of all this, stuff as ways to peel layers of stress off of your system. For some people doing the EFT, they can do that as a standalone treatment or tool, and then they feel a lot better afterwards. But I like the way Vicki framed it, because it's like taking one tool out of the toolbox and then I go and I do something else. So she's using several different tools to take care of her system.
What are the EFT techniques, or a sampling, a small sample of what?
So it should be in one of the handouts I gave you.
Mark, would you repeat the questions, please?
Okay. So what is the energy or emotional freedom techniques? I think you're looking at the grounding technique handout. Is that the only one you got?
Yeah.
Hold on.
It's the one with the body
Right
on
next
it,
to you,
but
there's
not
some extra
everyone
ones.
has one.
Oh, some of us didn't receive that.
Okay. Well, but we do have some extras of the emotional freedom technique handout.
Mark, your handout looks so wonderful, and I apologize for having jumped ahead because I didn't have a handout. I didn't realize you were going to move to that as quickly as you did. But I wonder if after this talk, you and I can email, and if you could send me that as an attachment, and then maybe Ray could send
Sure.
to anybody who who still needs it, we can make a list of people who want us to get that to you somehow.
It's a great idea.
Mail it or email.
Should I repeat that, Sam? Or anybody who wants a handout or more handouts that didn't get it, just let Vicki know or let me know, and we'll email them to you.
There's also a really good demonstration of EFT that I found, a video, a British woman that is showing. So maybe we'll do that too.
Okay.
So people can see how it's done. Are you going to demonstrate?
Sure, yeah, I'll demonstrate in just a minute. So you can go to YouTube, you can go to the internet and get video demonstrations of how to use this. It looks like a totally bizarre tool that shouldn't work as well as it does. And what I have found in my clinical practice is that it'll often bring a person's distress down by half in under 5 minutes. So if they come in and I say, how much does it bother you being in the situation that you're in, they'll say, on a scale of 0 to 10, with 10 being the highest, it's an 8. So then we'll do some tapping, have them think about the situation, maybe 3 rounds, takes about 4 minutes. And I'll say, what's your level of distress right now when you think about that? And they'll say, it's a 4, it's a 5. I can deal with that. You know, the 8 was a little inconvenient, but 4 is okay. So how to best provide it as a demonstration? I can use it with somebody on a particular topic. Maybe that would work the best. Is anybody willing to be that person?
Is this an emotional discomfort or a physical discomfort or both?
It's both an emotional and or physical discomfort. So physical discomforts, you would use it on as well. So the big thing is to state the problem as specifically as it is, as you can. So it could be this headache pain I'm feeling on the back of my head, not just headache pain. And then you follow like a recipe. The more exact you can be, the better. So you're willing to work with me on it? Great. Maybe I can get a couple of chairs. Where's Sam? Great. Okay, so she said she's done it, and she's got the CDs, which will make it a little bit easier for us. So your name is?
Judy.
Hi, this is Judy. So on your sheet, the first thing it says to do is what? What's step number 1? State the specific problem. So we had just talked about that in terms of how to do it with the headache. You know, rather than starting off saying, you know, on this stress, try and identify as specifically as possible what's stressing you. So you're trying to name it like you would name a chapter in a book or the title of a book. You want to keep it pretty short. So 3 or 4 words usually work the best. And then in step 2, quantifying. Then step 3 is you say an affirmation like, on the web generally, it's even though I have this fear that I won't be able to be there when he needs me, I deeply and profoundly accept myself. So some people, for the reasons of demonstration today, I'm only going to be able to go over this in a very surface, superficial way. Excuse me. Some people believe that the affirmation is really important. Some people believe that that really helps. Others think that it's just stating the problem and lighting up that part of the brain that's housing the problem, and that you're attempting to neutralize that charge by going to the different acupressure points and getting them to respond differently when it's thinking about that problem, that stressor. Does that make sense?
No.
Okay, let's just
I'd
do it.
suggest we switch
All right.
up so you can see it.
All right, so she's willing to stand up some more, you can see it.
Just stood up.
How did, when you do it, do you do the affirmation?
It depends.
Okay.
I have to say, I bought the whole set. It was on computer. It was on the network, free for 10 sessions. And I did about 7 of them, and I said, I want this. So I'd be glad to show anybody or share it if they would like to borrow it. So it also has a workbook. So it takes about 10 of the major issues that people have, emotional to physical to procrastination to whatever you are dealing with. And then I find that the process of having to get as clear as possible about what the problem is. So I'm going to say I could choose any number of things. I took migraine medication in the middle of the night, so I could say that. But I'm going to say it's a feeling of disconnection with my 3 daughters, adult, and I am mostly retired, and so I'm feeling lack of connection, some lack of purpose. I take care of a lot of people, but they're ultimately, they're old, they're going to die. And you asked earlier, why are we here? And so I came today because compassion and choices, the end of life choices. I mean, some of the issues that we've talked about, there are days when I just don't want to be here. And I think, okay, I want to start preparing for if I really don't want to be here. You know, what doctors do I need, what do I need to do? So I came because I want to be part of this community and have come off and on for years and years and know Ray. So I will say that it's disconnection and just the fact that I have to choose something, and not just have diffuse anxiety or go out and garden for 3 hours and just say, okay, I did something.
So disconnection.
So you asked me, how do I feel about saying the first part?
Right. So pick,
even though such and such.
I know what you're doing. So pick somebody, one person that you feel disconnected with. So in the spirit of making it more precise.
Okay. I feel very disconnected from Laura.
Okay. So now we're supposed to ask her how much that bothers her, right? So on a scale of 0 to 10, how much do you...
It's a 10.
10, okay. Great. So now we're going to go to the sore spot. We're going to have her rub on the sore spot while she's thinking of that and saying the statement, I deeply and profoundly accept myself even though I feel so disconnected from Laura.
And we're assuming this is everybody's sore spot? I'm not familiar with that.
Okay, do you use the side of the hand? Okay, so why don't, for our purposes, I'll talk a little bit about this more in a minute, but just to keep the flow going, why don't you go to the side of the hand and tap there while you're thinking about that disconnection you feel from Laura. So you say that 3 times. So I'm feeling very disconnected from Laura. I'm feeling very disconnected from Laura. Now we're going to go to the treatment points. I think that's the 4th one. Does it say go to the treatment points? Yeah. And then you can just follow along. So she's going to go to the eyebrow. And tap there. I want to make sure she's on the point because it won't work if she's not on the meridian. And then you go to the side of the eye and tap there. Yeah, you want to go more to right here. So some of us have to take our glasses off to get to that point, but it's really at the side of your eye. So you're tapping there while you're thinking about this disconnection I feel from Laura. Keep thinking about the negative. People don't like to do that. They'll say, I want to feel more connected to Laura. I'll feel so much better if I feel more connected to Laura. But think of the negative. Think of this as Norton antivirus, and you're trying to neutralize that bad software that's running in your system. So now you're going to go under your eye, right? And think about closer, right up closer to the bridge of your nose. You'll see people do this. They'll go to this point during the day. They'll take their glasses off and they'll start rubbing. We know intuitively where these meridians are. This is just putting it in a handy protocol. Now go under your nose and tapping, this disconnection I feel from Laura. And under your mouth, this disconnection I feel from Laura. Go to your collarbone. It's about 1.5 inches below your collarbone. You can feel a point. Don't go on your collarbone, but about 1.5 inches below. These are all acupuncture points. If you go in for acupuncture, this is where they're sticking the needles. So a lot of times people will refer to this as counseling without the needles.
Acupressure.
Acupressure, right. You might even go down a little bit more, sir. Go down a little lower. You know. So sometimes you know you're on the point because it really feels better, or it really feels more tender. So you might have to search a little bit, and then you'll kind of know when you're on that point many times. Now under the arm, about 4 inches under the arm. Ladies will say a lot of times it's right along the bra strap, and you just kind of tap there. To the other side again. This disconnection I'm feeling from Laura. The top of the head. Just tap on the top of the head. This one can take many forms. Some people like to go around the head. I saw someone earlier tapping on both sides of their head. Do whatever you want to do. Some people like to tap on the back of their head, go down to the bottom of their spine. I like that one. I can feel tingly, and then I know energy is moving. Okay, now we'll check back in, see what your number is. So now when you think of the disconnection you feel from Laura, what number would you give it?
Well, my mind is going to the circumstantial things, and what I'm really thinking is it'd be better if each of you have something in mind that you are working on. Excuse me. We'll say 7.
Okay. So if I was working with her in my office, then I'd say, is it still disconnection about Laura? Has it shifted to something else? If it's shifted, then we would follow that because we want to stay precise and specific. But you can see it's already gone down. It's already changed in some form, right? From a 10 to a 7. So in all likelihood, for the sake of time, we're not going to be able to keep doing it. But if we did another round, and correct me if I'm wrong in your experience, but it would probably go down to a 5, you know, and then maybe go down to a 4, 3. So you can get a lot of relief just from doing some tapping. Some people will do the whole set of treatment points, excuse me. Others will find great comfort in just going to the chest point and tapping. They'll find that to be very soothing.
Does it make you nervous?
It shouldn't. It shouldn't. That's the nice part about this technique is it has very few side effects, very few adverse reactions. It's safe for people to use at home.
So what we did not do was, even though I feel this discomfort or this lack of connection with Laura while doing that, I completely accept myself and the situation. I mean, you can be creative with what.
On this diagram that has the body, there's a hand also.
Yeah.
Initials on it, but I can't figure out.
Okay, so the hand points on the handout, they have initials with. Right, T is for thumb, I is for index finger, M is for middle finger, SH is side of the hand, BH is back of the hand. So these can be, no pun intended, handy points to use during the day. Some of us are trained to go to the sore spot. So if you look on the diagram of Mr. Steroid Man, you can see that there's over both pecs, there's a sore spot. So you go to that sore spot and you rub it. If you think of your body as an electrical unit, this would be the reset button. This is the circuit breaker. So when you're rubbing on the circuit breaker or the sore spot, a lot of people will just do that to help their system connect and dissipate some of the stress it's under. Other people will go to the side of the hand and tap, like Judy did. So you're just following that line on your hand over to the side, and you're tapping on that. And they call it the karate chop point because this is how they teach you to do it. But you can tap on anything. Sometimes, if I'm stressed before I have to give a talk, for instance, I'll just sit there and rub on the side of my hand. Or I'll sit there and I'll go like this and get to all those points on the hand. The back of the hand is a good stress point. That's the valley between the knuckle of the little finger and the middle finger, or your ring finger rather. So,
Mark, could you repeat what the thumb and the index and middle, what they all stand for? Or is there a specific intention for each of these?
there is, but it really goes beyond the scope of what I can do today.
Yeah.
But you could go on the web probably, or I can send you the information if you want. Each of these points is associated with a specific emotion. So this is often associated with the trauma point. This is often associated with anxiety. So that's why a lot of people like going to this point when they're anxious, because it helps calm their brain. Right. Go ahead. No, go ahead.
I just wanted to add to something. You mentioned EMDR, and I used to do this. I used to tap on my shoulders as an EMDR technique that just was so helpful. It's so simple, you know. I remember walking behind a friend of mine who was causing me distress, and just doing this and just feeling how I was feeling.
Can you get up and show everybody?
It's just this tapping your own shoulders. This was a technique of EMDR that was developed when helping, I think, children in Bosnia who had been severely traumatized in the war or whatever had happened, and they taught them to do this and to, you know, it's the same kind of technique as EFT, but it's so simple and you can do it virtually anywhere. So
they call it the butterfly hug. Is how I've been, how it was described to me. EMDR stands, it's another trauma therapy, and Vicky's talked to me some about how folks in caregiving situations that have had to deal with people with open wounds, you know, they can't get that intrusive imagery out of their mind, or the smells associated with it, and they'll go, it's a trauma therapy that's been around for 25 years that can be used to help the body release those intrusive images, smells, sounds that are associated with it. So I've only been doing it for 16 years and I still don't know how to explain it. And I've had people come in and they'll say, you know, we'll do a round of treatment and they'll feel a lot better. And they'll say, I had no idea what the hell this was before I came in. Now after I've done it, I have no idea what the hell it is. But I just feel better.
yeah.
And that's all we're after. As
all
long
that
as you're
matters.
feeling better, that's great. And do no harm. So, eye movement, desensitization, and reprocessing. So if we're in really, really stressful situations, the brain can only process so much of it. Even though we have the best supercomputer available, it can get overloaded. And then we have less resiliency, less tolerance. We have all those yucky things going on that I talked about. And this is just another way to get the brain moving again so it can process that information. As it does, that information will lose its charge, it'll lose how much stress it causes us, and we'll be able to move better throughout the day. Keith?
In relation to these emotional freedom techniques, by definition, the source of your discomfort is something that you don't want to be what it is, right? Judy mentioned something when she was up front about accepting the situation. Is that a sort of goal of this, accepting things as they are, or is that something that's virtually impossible at this point?
So Keith is asking a really important question about the statement. So is it step 3 that says rub your sore spot and then say the statement?
Yes.
I deeply and profoundly accept myself even though a lot of people love the affirmation. And a lot of people would rather not use the affirmation for different reasons, and they'll just state the problem. So yes, one of the goals is to be more accepting of yourself, even though this is going on.
But my question was in relation to accepting the situation in the sort of Stoic sense of willingly accepting things the way they are, letting them be what they are so that you can move on and deal with them. Is that a goal of this technique?
It's a really complicated question. Go ahead. So he's asking if the goal is to be able to, how did the British say it? Carry on?
Keep calm and carry on.
Keep calm and carry on.
I was just simply going to say that a type of affirmation like this is being able to accept being in the now. And just by being in the now, it's accepting all the concomitant aspects of the past and the future in the present, so to speak. So I think that's an affirmation of trying to just be in the present, it seems to me.
So her response was that it's just an affirmation of trying to be in the present and to deal with it more effectively.
Well, relax into the moment because you can't change it.
So relaxing into the moment because we can't change it. That's a beautiful answer. That's a beautiful description of what it can do.
Thank you.
I don't have a good answer, Keith. We spent hours in supervision on this answer.
She was getting there. She was getting to what I was getting.
Vicki?
I guess one response I would have is that this technique, I think, has us accept that we're having these feelings. And accepting those feelings, I think, as long as we don't even acknowledge we have them, we can't even process through them or let them go. But when we accept that we have them, we're saying, oh, that's right, I'm feeling fear, some anger, and grief. And it's all bollocksed up in anxiety. And once you can say that, that's the first step in being able to release it, because as long as you're resisting it, it's going to persist.
Yeah.
But the other part of your question, I thought, and I love your answer to this, is that accepting the situation, don't we all have so much trouble with that? Because we're wanting to change it. We're wanting to fix it. So how do we deal with that? And I guess that's what therapy is for.
Sometimes, right.
It sure helps.
Right.
That's when you go and make an appointment with him.
Yeah. He's got his number.
Yeah. Judy?
The person that I heard resist that statement, I accept myself, they say that's implying that I don't already accept myself. So I think this suggestion, I accept these feelings, even though, you know, I accept these feelings right now, and that would soften for those who feel they fully accept themselves and that this is a negative statement.
Or for people who can't accept themselves.
Yeah.
My daughter's co-parent feels he can't do this, he can't say that. He doesn't feel he loves himself deeply and completely, you know. And that's the other thing, is like, and practicing that can help.
It was a little bit like not wanting to be the neighbor when the advice is love thy neighbor as yourself. That's not always a good advice.
Right, exactly.
We have a few more minutes left. Any other comments?
I know that we're talking about caregiving, but I'm wondering, are these points, can you use those also on someone with severe dementia?
You know,
Can you use these on someone with severe dementia? Can you do it to them?
No, not can you, but could you do this and have them follow you
Yes.
with?
yes.
I mean,
Can you have the person who has dementia
Right.
use this to calm
Yeah, I mean,
themselves?
is that possible?
Well, there is a myriad of ways that EFT has been used, and it's all on the internet. There are many, many ways. And I know that there is a way that you can do it for somebody else. That's one thing that's been developed. That there are EFT practitioners who you can try it on anything. You can try it and see if it helps, you know. So people have been doing that, and there are many ways that So if you just go on the internet and do some searching.
I think that the short answer is yes.
Yeah.
That was a great, I can see the trouble I'm having sometimes, because these questions are so multi-layered and sophisticated. The short answer is you could reach over and just tap on his chest right here on this point to see if it calms him. Or you could say to him, just tap here, just do what I'm doing, try this. Here, do it here. So it's worth a try. You can really do no harm with it. You can try it on anything, whether it's headache, pain, emotional stress. One more? Any more? Last one?
Back to the sleep matter, the various methods for the caregiver to get sleep. I think, first of all, he needs it desperately. And on the other hand, let's say, okay, one way is a spouse that we can do. You might say, well, switch from the double bed to a single bed. Okay, that may or may not help. It may even hurt, because on the one hand, the caregiver goes in and wants to sleep. And in fact, even may be able to sleep at this level. But he or she at the same time is alert and wants to be alert to the patient, and the spouse, whatever you want to call it. Patient sounds too impersonal, but anyway, to the patient. And of course, the patient is sleeping very poorly, most often, I think, in cases, very poorly. Wakes up, wants to get things, wants to get water, and each of these moves awaken you. And well, I see it as a dilemma. Okay, you might say, well, if you can afford it, get somebody else to come in and sleep at night. That, in most cases, that is negative, because that would really, or could, maybe not, could set back the patient. Here you're abandoning me, let's say. Now, maybe I exaggerate, but that's certainly a problem.
So I think what he was saying is that there are no easy answers. There's really complicated situations, and we don't mean to be overly reductionist when we talk about different things you can do, because you can try and solve one problem and create another problem.
And the sleeping pills are good in this case.
Right. So thank you very much for your attendance here.